Pregnant women with high blood pressure. After the 20th week of pregnancy, eclampsia, often known as eclampsia, is characterized by high blood pressure and an excess of protein in the urine. Eclampsia most commonly causes mildly increased blood component readings, but if left untreated, it can progress to a variety of problems, including death of the mother and fetus. Pregnant women's high blood pressure types. Eclampsia is one of 4 syndromes that induce excessive blood pressure in pregnant women. The other 3 are as follows. 1. High blood pressure during pregnancy. Women with high gestational blood pressure have high blood pressure, but they also have an excess of protein in their urine. Eclampsia can develop in certain women who have excessive blood pressure during pregnancy. 2. Hypertension that persists. Chronically high blood pressure occurs before the 20th week of pregnancy and can last for up to 12 weeks following birth. It is more likely that the elevated blood pressure was present before the pregnancy but went undiagnosed in this case. 3. Eclampsia in the presence of chronically high blood pressure. This condition refers to women who have persistent high blood pressure that is unrelated to pregnancy, and whose blood pressure levels rise dangerously during pregnancy, in addition to an excess of protein in the urine. High blood pressure symptoms during pregnancy. High blood pressure symptoms during pregnancy include high blood pressure, proteinuria, excess protein in the urine, after the 20th week of pregnancy, an excruciating headache, vision changes such as momentary vision loss, blurred vision, or extreme light sensitivity, abdominal pain, usually centered below the ribs on the right side of the rib cage, vomiting and nausea, vertigo, excessive urination, weight gain of more than 1 kilogram each week in a short period of time, swelling of the hands and face. High blood pressure during pregnancy, causes and risk factors. Eclampsia is referred to as poisoning since it was once thought that the presence of a toxin, a toxic material of biological origin, toxin, in the blood of a pregnant woman caused the ailment. The reason of preeclampsia is currently being investigated. High blood pressure during pregnancy has several causes. Insufficient blood supply to the uterus is a possible cause of elevated blood pressure in pregnant women. Blood vessels are damaged. Immune system difficulties. Nutritional deficiencies. High blood pressure during pregnancy, risk factors. Eclampsia only occurs during pregnancy, and the following are risk factors for acquiring it. Personal and family medical histories. The first pregnancy, because the risk of preeclampsia is highest when a woman falls pregnant for the first time. Growing older, as the risk of eclampsia rises with age in women over 35. Overweight. Pregnancy in multiples. Diabetes during pregnancy. Long-term illnesses such high blood pressure, diabetes, kidney disease, and lupus. High blood pressure complications in pregnant women. The majority of women who have eclampsia have healthy babies, and the more severe the eclampsia is and the sooner it develops in pregnancy, the greater the risk to the mother and the fetus. High blood pressure during pregnancy can cause the following complications. Blood supply to the placenta is reduced. Abruptio placentae, which produces significant bleeding and puts the mother and fetus in danger. Hemolysis is a condition that causes the body to lose blood. Eclampsia maligna. Diagnosing hypertension in a pregnant lady. Preeclampsia is diagnosed when a pregnant woman has high blood pressure and proteinuria, both of which can be detected through urine tests. Eclampsia can occur suddenly during a pregnancy test, such as a blood pressure reading. Urinalysis on a regular basis. Results of blood pressure measurements. The following are the blood pressure interpretations. A blood pressure reading of less than 130/85 Hg during pregnancy is considered normal. A reading of more than 140/90 of a millimeter of mercury is deemed high. However, A single reading of elevated blood pressure does not necessarily indicate eclampsia. If a blood pressure measurement reveals a high result, the attending physician will follow up and continuously monitor blood pressure in the future. In addition to constant monitoring of protein values in the urine, the doctor may urge the pregnant lady to come to the clinic and have her blood pressure measured at a higher rate than usual. If the diagnosis of eclampsia is established, the treating gynecologist will request a number of further tests, including a liver and kidney function test, checking the platelet count, platelet test, imaging with ultrasound, fetal pressure check, which is a basic procedure in which the fetus movements are tracked for a set length of time and the fetus heartbeat raises as a result of its movements. A uterine examination of amniotic fluid. Treatment for high blood pressure in pregnant women. The treatment of high blood pressure in pregnant women differs based on the circumstances. 1. Treatment of hypertension in the first trimester of pregnancy. In the early stages of pregnancy, birthing is not the best option for the fetus, and the woman must follow the following guidelines. Commitment to bed for comfort, giving the fetus enough time to finish its development and growth. Medication, to assist the pregnant woman and the fetus. Obstetrics is the best and last option for preeclampsia treatment. 2. High blood pressure treatment for pregnant women in the final stages of pregnancy. If the pregnant woman is at risk of seizures, early placental abruption, or serious bleeding to the point of a dramatic drop in blood pressure, childbirth is the best treatment for her blood pressure.